Good afternoon, and thanks to all of you for joining us, and thanks to those that are either watching online or on television. I'd first like to start by saying that I know this was a very difficult weekend on a lot of Virginians because of the ice storm. I know there are individuals in Hopewell that still don't have access to water, and everything is being done to return that. There are still people across the Commonwealth that don't have electricity, and we certainly regret that. And our Virginia State Police and other law enforcement agents answered to hundreds of motor vehicle accidents. And unfortunately, we have some more weather coming. So I would pay attention to the TVs, the press, and also be prepared. But today, I want to start with some exciting updates that we have to share. Our COVID numbers are going down, and our vaccination numbers are going up. And today, I'm excited to show you our new statewide vaccination pre-registration system. First, I'd like to take a quick look at the data. We've administered now more than 1.4 million vaccine doses. 12.4% of Virginians have received at least their first shot. That puts us 12th in the nation. We're the 12th largest state, so that's exactly where we should be. We've used 87% of the shots we've received, which puts us 7th in the nation. So we're getting these out the door as fast as possible. On average, we're giving almost 34,000 shots per day. As you know, our goal is to be doing 50,000 shots a day. We have the infrastructure to do that when we can get the supply. And I talk to our governors, our fellow governors every day. Supply is the key to getting this vaccination into everybody's arms. Part of the infrastructure is making sure we have enough people who can put those shots into arms. This week, I was glad to sign emergency legislation that will allow more medical professionals to give vaccine shots. Folks like dentists, medical students, and others. I want to thank Delegate Lamont Bagby and also Senator Savon Donovan for sponsoring this legislation. The bill also requires vaccinators to collect race and ethnicity data, which will help us fill an important data gap. Tracking this is a critical step to ensure we're distributing vaccine equitably and including the communities that are most vulnerable to getting the virus and also getting sicker from the virus. Now I'd like to talk about the pre-registration system. We have heard you. You asked for a unified statewide system where you can pre-register and get confirmation that it went through. And Virginia is delivering. Yesterday, we launched the website and pre-registration tool. The response has been very strong. At the peak, the new site was getting 300 registrations per minute, and it averaged 150 registrations per minute. All told, 240,000 Virginians signed up since this launched, and I'm one of them. That tells us that the system is working and that it's meeting a demand. Today, we're launching this second component of this system, a dedicated call center for those folks who are more comfortable talking to a human being than going online. Together, this is a one-stop shop for Virginians to pre-register for vaccination so that when your turn comes, the health department can easily reach out to schedule you for your shot. I'd like to walk you through what this looks like. The new site is vaccinate.virginia.gov. When you type that in, this is what you will get. Now, let's say you want to pre-register. You click the blue button in the middle that says pre-registration. It will take you to this page where you can check your registration status or click Sign Up to get to the pre-registration form. A couple of important points that I want to note. One is that if you have already pre-registered through your local health district, you don't need to register again. The data from local health departments is being automatically imported into the new system. 1.6 million records, I will repeat that, 1.6 million records were migrated over the weekend. Everyone who previously registered is still on the list. But if you know you pre-registered and you can't find your name on this new system, don't worry. While much of the data migration from local health departments is done, the rest of it is continuing this week. So it may take several days for your name to show up in the centralized system. If you don't find your name, just check back in a few days. If you haven't pre-registered, here's the form you'll fill out. When you're done, you'll get a confirmation. This new system will provide functionality we have all been asking for. One, it's centralized, which makes it easier on our local health departments. And two, it gives you confirmation that you've signed up and periodic update emails. The first one went out last night, and I also received that email. Now, let's talk about the call center. We know that some people prefer to talk to a live person. I'm one of those people. That's why we also made a dedicated call center a priority, and that launches today. You can call 877-VA-ACTS, excuse me, let me start over. 877-VAX in VA. Maybe that's a little bit clearer. 7 days a week, between 8 a.m. and 8 p.m. And for those that don't want to connect the letter to the number, this is the number, which I also appreciate. 877-829-4682. So I'll repeat that because that's not written down. 877-829-4682. You can speak to someone in English or in Spanish. Or you can get a call back to speak to someone in 100 other languages. In addition, the call center will prioritize callers aged 75 and up and those who speak English. Excuse me, those who speak Spanish. I apologize. We have hired 750 call center workers to staff those phone lines. 69, or about 10% of those, are Spanish speaking. We expect this is a starting point, and we will hire more people as needed to meet the demand. The call center will allow you to talk to someone who can answer questions, and they can help you get pre-registered. They have the same access to online pre-registration forms. So if that works better for you, please call. But I do not want to say that as this launches, many people will be calling. If you can use the online form, please do so, and let our call centers workers help those who don't have internet access or who are having trouble with the online form. And a note of caution, unfortunately, there are people out there who would take advantage of the high interest in vaccination. Please remember, and this is so important, the vaccine doesn't cost you anything. Don't respond to anyone asking for money to reserve your shot. Now, to ensure that the majority of people listening get the essential information on how to access this system, I'd like to invite our Director of Latino Outreach, Maribel Constaneda, up to deliver this message in Spanish. Maribel, welcome. Thank you.
Buenas tardes. Mi nombre es Maribel Castañeda y soy la directora del Alcance Latino para la Oficina del Gobernador. Virginia está lanzando un sistema de preinscripción para vacunas en todo el estado, con el fin que haya un proceso único y completo para que así todas las personas en Virginia se preinscriban para recibir la vacuna del COVID-19. El gobernador entiende que nosotros queremos una forma sencilla y fácil para obtener la vacuna del COVID-19. Quiero aclarar algunas cosas. Para registrarse en línea, vaya a vaccinate.virginia.gov y haga clic en preinscripción. Se le hará una serie de preguntas básicas y cómo prefiere ser contactado, cel, mensaje electrónico o mensaje de texto. Ya cuando termine el registro, recibirá un número de confirmación. Recibirá actualizaciones periódicas en español para que sepa que todavía está en la lista. Si ya se encuentra en el sistema, no envíe otro formulario. Esto podrá retrasar el proceso un poco. Si ya envió un formulario de preinscripción o una encuesta con su departamento de salud local, puede confirmar si quedó preinscrito en la página de preinscripción. Si prefiere hablar con alguien directamente, puede llamar al 1-877-829-4682. Una vez más, es el 1-877-829-4682. La línea directa está abierta de las 8 de la mañana hasta las 8 de la noche, todos los días. Habrá representantes quienes hablan español para responder a sus preguntas y pueden ayudar con su preinscripción o verificar su registro. La preinscripción es solo el primer paso del proceso. No programa la cita para que reciba la vacuna. Recuerde que nunca vamos a preguntar sobre su estado migratorio y la vacuna es gratis para todos. Gracias.
This new system will be a tremendous step forward in our vaccination work. We've been getting around 130 doses, first doses per week from the federal government. That's an increase from the early weeks when we were receiving about 105,000 doses per week. But it's obviously not enough to meet the demand. I know that President Biden's administration announced yesterday that they are increasing allocations to the states, and that is wonderful news. We'll take every dose that we can get. We are in regular contact with our federal partners, both in the Biden administration and in our congressional delegation. I promise you we are not shy in asking for what we need, and later this evening I'll be in communication again with our congressional delegation. And we have had a very good working relationship, and they have been very helpful, especially with COVID relief. Just last week, I joined Maryland Governor Hogan and D.C. Mayor Bowser in writing a letter asking that the federal government help us vaccinate federal employees, as well as contractors, which includes thousands of employees in Virginia. I spoke about vaccine supply limitations. An additional and separate pot of vaccine is going directly to our pharmacies through their partnership with the federal government. Right now in Virginia, that's just one pharmacy chain, but our health department is working with the Centers for Disease Control to put a greater emphasis on community pharmacies. We also want to ensure that pharmacies can work with our pre-registration system. I know that a lot of our small pharmacies are willing and eager to vaccinate their patients. Many of those pharmacies haven't gotten any doses yet because the supply is so limited. But we know that small, independent pharmacies are an important partner in this effort, and we're working to include them. I want to take a moment to also look at our COVID trends. I mentioned earlier that our cases are trending down, and that is great news. So you can see that here. And our hospitalization numbers are going down as well, which is also excellent news. We need these trends to continue. Cases down, vaccinations up, as we develop a long-term plan for how to get back to life as we knew it a year ago. Remember, our first case of COVID-19 was on March the 7th. We're almost at a year. I know that everyone has lots of questions. Will more people be able to come watch their kids play sports? I hear that every day. Yes, they will soon. Next week, sports start moving outdoors. So starting this Monday, we'll expand the number of spectators allowed at outdoor sport events up to 250, provided everyone maintains their social distancing. Next question. Will children be able to go to overnight summer camps? Yes, they will this summer. What about outdoor events? Well, we're moving on that as well. And we'll be working with stakeholders to move forward safely over time. But I need to be clear, the basic safety needs will stay in place for the foreseeable future. Wear a mask, wash your hands, maintain your social distance. This applies to people who have been vaccinated as well. We know that these measures work. As we look at all of the measures that are in place, we're going to take a deliberate, cautious, step-by-step approach. We will move thoughtfully and safely over time. I am pleased, however, to see that our school divisions are stepping up to the challenge I set for them 2 weeks ago. I asked our schools to move aggressively toward plans for how to have in-person learning options by March the 15th. At that time, if you remember, about a third of our school divisions lacked plans for in-person learning. That represents 500,000 students in Virginia. Today, that number is down to just 3 or 4 school divisions, and we're working with them on solutions. In other news, I want to remind everyone Virginia has lots of opportunities for you to learn more and get the information that you need and that you deserve. You can find it at vaccinate.virginia.gov. Or tomorrow, William & Mary is hosting a forum with Dr. Anthony Fauci. You can watch it online on the college's website at 3:30. And finally, as I mentioned earlier, a serious winter storm is forecast for parts of our Commonwealth. This map shows you the worst-case scenario snow totals that the National Weather Service at Wakefield is predicting. For many of us, we'll also be seeing significant ice. This could result in more power outages, so Virginians, now is the time to prepare. And if you don't need to be out, please stay at home. I want to take this opportunity on behalf of all of us in Virginia to thank all of the utility crews at Dominion Energy, Appalachian Power, and our co-ops throughout Virginia. And I also want to thank the Virginia Department of Transportation and other road workers, the Virginia Department of Emergency Management, the state police, and other law enforcement, and everyone who works every storm to keep us all safe. They did a great job in the storm that we just had over the weekend, and I'm grateful to them for everything they'll do in this storm as well. So pay attention to the forecast and please be prepared for the worst.